Very often at my workplace, when a male infant comes for circumcision, we usually argue within ourselves between the male and the female gender who feel the most pain. For instance, the female often encounter periodic pain, pregnancy pain, and all the rest, while the male gender usually feel the most crucial pain, especially at the tender age during circumcision. But you know, the male will always say that males feel pain no matter what, while the females say that the female gender feel pain every month whenever they have their period, pregnancy pain, labor and delivery, and all the rest. But male just feel that crucial pain at the very tender age during circumcision. So I want my viewers to join in this conversation. What do you think? Do you think that female feel pain more than male? I want to hear your opinion in the comment section. Hello everyone, what's up and welcome back once again to my channel. This is Get Value with Nurse Chinyere, and in this channel we get to discuss fertility health, sexual and reproductive health. In today's topic, we are going to look at what every woman should know about her sexuality before the age of 30. So if this topic interests you, let's get straight into it. First on my list is having a basic knowledge about menstruation. Menses, for short, usually marks the end of puberty. Every female child experiences menstruation, usually on the average at the age of 12 years, while some can see theirs as early as 10 years and some as late as 15 or 16 years. So what is this menstruation? This big word, what is it all about? It's just the monthly flow of blood from the uterus. You know, the uterus is just like an enclosure where a baby is formed. So when there is no baby to form in the uterus, the lining surrounding the uterus begins to break down and it comes out as blood. When a woman is not pregnant or not having any medical problem, it is normal for blood to flow every month. This blood that comes out of the uterus has an exit, and it is the vagina. So that is where the blood comes out on a monthly basis. Therefore, if a woman is not pregnant or not having any medical or fertility problem, it is normal for her to have a menstrual flow on a monthly basis, because this activity happens on a monthly basis continuously. We call it a cycle. Therefore, the name menstrual cycle. To calculate a menstrual cycle, you count from the very first day you start seeing period, that is, you start seeing blood, to the day before the next one. A healthy cycle is usually between 21 to 35 days, but the average is 28 days. So if your own falls between 21 to 35 days, it is considered normal, okay? Another thing I would like you to know about the menses is that before it occurs, for some people, they feel mild cramps or PMS, which is known as premenstrual syndrome. So don't allow anybody to shame you for feeling the way you feel whenever you have your menses. Some of the symptoms of PMS include bloating, that is the feeling of gas accumulation in your abdomen. We have weight gain. At that time, there is an increase in weight. Then for some people, it can be acne breakouts. We have mood swing and irritability. That is an intense surge of frustration or anxiety over things that does not matter. There is brain fog. At that time, some women will begin to forget things. Then for some others, it comes as insomnia, that is inability to sleep well. There is crying spells. You see women, they begin to cry over things that are irrelevant. Then the last but not the least is food cravings. Some women will begin to crave for sweet things and some certain kind of food. Therefore, if you have any of these symptoms, you are not alone. It's quite natural and normal. For women who feel cramps during this time, you can apply hot water bottle or heating pad over your lower abdomen or at your lower back to help relax your muscles and make you feel better. When this measure is not giving you any positive results, you can try taking over-the-counter pain relievers like ibuprofen and paracetamol. You can also try sleeping or resting on your side with your knees tucked towards your chest. Another thing I would like for you to know is ovulation. It is that time in your menstrual cycle when you release an egg for fertilization. It can be on the 7th day, on the 10th day, on the 14th day. It all depends on the length of your menstrual cycle. So it's good for you to know how to calculate the length of your menstrual cycle so that you can be able to determine when you'll be ovulating. Whenever ovulation occurs, it lasts for about 24 to 48 hours. There are some cardinal signs for you to know that you are ovulating. The first one is cervical mucus changes. The fluid that comes out from your cervix becomes clear, stretchy and slippery like that of an egg white. So when you begin to see this, it is a clear sign that you are ovulating. Another one is change in basal body temperature. So at that time, your temperature will drop by 0.5. So if you are tracking your body temperature, you will notice a dip by 0.5. There is also mild cramping or pain on one side of your lower abdomen. For some people, it can be breast tenderness, bloating, or heightened sense of smell. If you are experiencing any of these, it is quite normal for this to happen, okay? At this point, if you are learning something from this video, kindly take a moment to hit the subscribe button. Another thing for us to know is period products, because knowing how to use them correctly can prevent leaks, discomfort, and life-threatening infections. First is pad. It sticks to underwear to absorb fluid externally. It is advisable to change it every 4 to 6 hours because leaving it to stay for long can lead to bacterial growth and odor. In addition to pads, we have tampons, a cotton cylinder inserted internally into the vagina to absorb fluid. It is advisable to change it every 4 to 8 hours because leaving it there for long can also lead to infections. Finally is the menstrual cup. It is a flexible silicone cup that collects fluid internally. Furthermore, the frequency of change is every 8 to 12 hours. Let's also talk about the choices of pants and underwears. It is advisable to use 100% breathable cotton underwears during your periods. Synthetic fabrics like polyester, nylon, and satin can trap heat, sweat, and menstrual moisture. This creates a breeding ground for bacterial vaginosis and yeast infections. Then for pants, avoid tight synthetic leggings, skinny jeans, or tight leather pants. Tight clothing restricts airflow, increase friction against pads, and add unnecessary pressure to an already bloated, cramping abdomen. Therefore, opt for loose cotton joggers, wide leg trousers, or breathable skirts. The last but not the least I want every woman to know is contraception. Taking control, taking charge. Understanding your birth control options gives you absolute autonomy over your future, your education, your career, and your life in general. There is the barrier method of contraception, such as the use of condoms and cervical caps. Another one is the hormonal method like pills, patches, and rings. Then the long-acting reversible methods like use of intrauterine devices and hormonal implants. The last but not the least is the pull-out method. This brings us to the end of this video. If you have any question for me, kindly drop in the comment section and I'll be there to respond. And if you have gotten value so far from this video, kindly hit the subscribe button and turn on your notification bell because there are more educational contents coming your way. In our next video, I'll be talking about postnol in details. Don't forget to like and share this video to family and friends. See you all in my next one. Bye!